Okay, here is my central line dressing change video. This is like my 6th time trying to record this video. My baby, my newborn, is attached to me today and he keeps crying, so if he starts crying in this one, I'm just gonna keep going. So please bear with me. My husband's on night shift, so it's just me and him tonight. Okay, so I have set up my PICC line dressing kit to be like the ones we have at my hospital, because it's what I'm used to doing on a regular basis, where you open the kit and there's 2 sets of sterile gloves. So the first set you use to set everything up and remove your old dressing, and then the second set to apply your new dressing. So I've already verified the physician's order. I'm going to enter my patient's room, close the door behind me to provide privacy. Hello, Mr. Monkma. My name's Marina. I'm going to be your nurse today. And can you state your name and date of birth for me? I'm going to compare it to his wristband and the medical record. Okay, so I'm here to change your PICC line dressing. We have to do it every 7 days to prevent the risk of infection, reduce the risk of infection. Do you have any questions about your dressing change? Okay, so we're both already wearing masks. You would usually have your patient turn away from the dressing change or wear a mask. Per the checklist at my hospital, we always have them wear a mask. So I washed my hands when I came into the room. So I've already gotten my supplies, and I'm going to go ahead and set up on the bedside table that I have adjusted here, and ensure that the PICC line is lower than the level of the heart. I'm going to open, apply my first set of gloves. We'll pretend these are sterile gloves. Set up sterile field on my bedside table. Got all our supplies here. I'm going to go ahead and remove the old dressing. Just have this off to the side a little so I'm not reaching over everything. Remove the old dressing, remove the stabilization device. Be really mindful not to dislodge the catheter during this part. Then I'm going to remove these gloves for hand hygiene. So, got my new set of sterile gloves. I'm going to do this up here so you guys can see well. I'm pulling out the edges here. Okay. Don my sterile gloves. Of course, I put it back in the kit backwards. I'm going to start this one over because I put it back in the kit the wrong direction. Okay. Toss that. I'm going to take my CHG, break it, make it all in the sponge, and I'm going to clean the dressing, or the catheter from the insertion site outward, a good 2 to 3 inches around, and you want to do this for at least 30 seconds, not to go back from the outside back to the insertion site because it would be contaminating the site. And we'll let this dry completely. Not going to pat it or blow on it, or to dry it off, let it air dry. Then I'm going to apply skin protectant. It also helps the new dressing stick. Let that air dry completely as well before applying a new stabilization device, a stat lock. So now that I've got the new stat lock, you also want to note the amount of external catheter length. Make sure that it's not migrating out. Okay. So now that our new stabilization device is on, we will apply our new dressing. I will sign and date this additional strip here once we're all finished. So now I'm going to, I made sure that the lumen was clamped at the beginning before I started all this. So with my lumen clamped, I'm going to remove the old PPV, or I think the book calls it something at the end of the catheter. We call it positive pressure valve. So I'm going to remove the old PPV, and I'm going to scrub the hub of the catheter with CHG wipe for, at least 30 seconds. Let that dry. I'm going to apply a new PPV, or end cap connector, I think the book calls it. Then I'm going to attach our saline syringe. I'm going to flush a little, pull back just enough to see blood return in the lumen, not into the syringe. Our patient's trying to run away. And then I'm going to flush the catheter with a pulsatile motion, which helps prevent the buildup of fibrin on the inside of the catheter. Okay. Now I'm going to apply we call them Kuros caps, alcohol cap, to the end of the PPV. I'm going to remove my gloves, wash my hands, and clean everything up. Then I would sign date, initial date, and put this additional sticker on the dressing with time, date, and initials. And that is my central line dressing change video.